All right, now we're going to talk about the worst enemy in terms of Social Security, the future of Social Security. Who is out there trying to kill Social Security? That's wanting to make the trust fund, deplete the trust fund. That's ending Social Security in the future and all that. Well, it's guess what? It's not who you think it is. So we'll talk about that today, and that should last about 10 or 15 minutes. This is the last day of the Medicare season, AEP. So I want to make sure we get as many people helped there as possible. So we'll do a live Q&A for the next 50 minutes after I talk about the worst enemy in Social Security. And then I got a special guest for this last day. So make sure you join. And if you have any questions on all things Social Security, retirement, survivor benefits, disability, Medicare, make sure you type them in the chat and I'll get to as many as we can within the hour. Okay, so who is the worst enemy of Social Security as I see it? The chief actuary of Social Security. Go figure. Who is the chief actuary of Social Security? Well, that's the person that runs the numbers. And unfortunately, that person's job is to run the numbers for 75 years. So the chief actuary of the United States of the Social Security Administration has to look at the books, how much is going to come in, how much is going to go out for the next 75 years. And I mean, Wall Street, they look at the books for the next quarter. Okay, how many billions of dollars are we going to make in the next 3 months? But Social Security, part of the mandate, they have to look at intergenerational, the future and everything like that for planning purposes. And that's what really, really, really hurts Social Security. Why? Is because if you look at anything over 75 years, the inevitably, my prognosis for the next 75 years is not going to be good. Um, Hopefully, let they come out with new medications. But anyway, um, but 75 years, they've been talking about this for decades. The fact that the trust fund is going to be ending, and it is going to be ending here. And I'll pop up the graph I show for those regular viewers that watch. So if we look at as of right now, if we don't do anything, there's going to be a 21% cut in 2034. If the next administration does some of the things they're talking about, it'll be a few years earlier and about a 33% cut. If we do what we need to do and fix it, and if you look at the description down below, I've got, guess what? The actuary not only is kind of Social Security's worst enemy because that's the person, the doom and gloom, and the sky is falling, chicken little, and but that person also on the his other part of the job is to come up with solutions. So if you look at the description under this video, you can see that person's prognosis and how to fix it. And there are dozens of people that have come up and said, well, maybe we should try this. And then the actuary goes in there and pulls out the calculator and says, okay, well, if you do this, it'll solve 3%. If you do this one, it'll solve 21%. If you do this one, it'll solve 73%. And regular viewers of this channel know I always pick the one that's 73%. I've talked about that many, many times. We don't want to get into that today. But so if we fix this, if we get our grade schoolers together to add the 73% fix and the 21% fix and the 3% fix, and we add those all together and we're all good. But unfortunately, again, we have kind of fatigue. We are Social Security's ending fatigue, and that's because of the 75-year projections. We've been, talking about these cuts for decades, and people are just tired of hearing about these cuts, and they've just kind of thrown up their hands and they say, well, it's dead anyway. It's not going to be around in the future, so who cares? And then who jumps on that? Guess what? Politicians jump on that, and they use that as an opportunity to go ahead and, kind of self-fulfilling prophecy. Okay, well, you said it's not going to be around here 40 years from now. Well, since it's not going to be here anyway, let's just go ahead and, do this, that, and the other, cut benefits. The solution is always to cut benefits or to give it over to Wall Street. And if you're a regular viewer, you know that is not my cup of tea. The Probably the biggest ones, I'll go ahead and throw it out there for the new people out there, but the one 73% fix is right now, a lot of people don't realize that 99.9% of people watching right now, you pay FICA tax, FICA Social Security on all your wages, 365 days of the year. So you pay 6.2%, your employer matches it 6.2%. Unfortunately, if you're self-employed, then you're your own employer, so you have to pay both. But that ends at $176,100 for next year. After that, guess what? You're in the free. You don't pay Social Security FICA tax anymore. You pay Medicare tax, but you don't pay Social Security tax anymore. And that's the issue. There's more money going to the top and less money going into the Social Security. And that is the biggest root of our problem in the future and why we're going to get cuts. So if you look at the actuary report in the description, you can see that solution is to smash the cap and have everybody pay into FICA just like everybody else. But so the actuary is kind of the worst enemy, and at the same time, he is our, I guess, our he or she is our best friend. So, all right. So let's since it's the last day, I didn't want to spend a whole bunch of time on that. I would be more than happy to answer any questions on that you have on all things Social Security, Medicare, the future of Social Security, policy type issues. But we want to get into as many questions as possible. And let's see here. Let's see what we got popping up here. Let me go ahead and oh, and we want to add our special guest. And let's go ahead and pop them in here. So we've got Kobe Gantz, and he is the CEO of Chapter. Regular viewers know that when I retired from the Social Security Administration, I took about a week off, got bored, decided to come back in and help people with all things Social Security, retirement, disability, Medicare A and B. I didn't want to get into the whole C and D, the Medicare Advantage, the Medicare Supplements, prescription drug. Those are private companies. But I just saw so many bad actors out there, people doing the wrong thing, people not getting the information that they need from these private companies out there, these private insurance agents and brokers. So my son and I decided to, if we've got to, there's got to be someone out there that does the right thing. And so we looked and looked and looked, and we found Chapter. And we talked to Kobe, and he's got a great story of why he is helping people with all things Medicare. It doesn't hurt that he is, he also supported the Marines in Okinawa. I was a Marine in Okinawa a couple of years earlier than that. I think it was in the 1920s. I think I was there. But anyway, so Kobe, thank you for joining us. We really do appreciate it on this very last day of the annual enrollment period. So this is the wire. If you don't change your Medicare, you don't review your Medicare Advantage plan or Part D plan now, then yeah, you're pretty much done for the rest of the year, right?
That's right. Thanks for having me, Dr. Ed.
Yep. So tell us why you got into this, why you moved from your temporary time in helping the Marines in northern Okinawa to helping in Medicare.
I used to work at a software company that supported the US military. I was focused on supporting the Marines with analyzing data to deal with military intelligence. Um, During my time there, I learned a lot about how the government uses data, could be more efficient with using data, and it's really challenging to use data effectively broadly, especially for large organizations like the military. Around the same time, a few years ago, I was seeing my parents struggle with Medicare. They were going through the Medicare sign-up process and were working with a local Medicare broker who was very well intentioned, but didn't have the data or the tools to be particularly effective. I saw their experience. They had to go through tens of phone calls, had to fax different offices. And it was not only anxiety inducing, but they also had to ended up paying far more than they needed to for identical coverage. And my mom was left with a late enrollment Part D penalty because she got bad advice. And when I took my prior experience of how do we use data to make our lives better, and looked at what was happening in the Medicare industry, I just was pretty appalled at how bad the technology is, how bad the data is, and how bad the incentives are. And so I wanted to start an organization that really takes the best practices of really good software, really good data, really good engineering and technology, and applying it to an industry that really has been underserved because, frankly, people of my generation who are pretty good at building technology don't see Medicare as a problem a lot because it's not front and center for us. And so have been building this organization Chapter in partnership with Dr. Ed, and we have built an unbiased citizen first Medicare advisory. So we look at every single Medicare option, whether whether it's a Medicare Advantage, Medicare Supplement, Part D, doesn't matter. We look at every single Medicare option. We take clients' input, whether it's their doctors, their prescriptions, their location, their lifestyle preferences, their willingness and ability to pay, et cetera. And we recommend the right plan for each person, regardless of economics. And we employ all of our Medicare advisors. They're all licensed and trained and interviewed by me personally. And we employ all of them. We don't use contractors. We don't use 1099s. And in that way, we're able to make sure that we have really high quality support for everyone. And we've built our own technology platform, our own data that allows us to give our Medicare advisors superpowers so that they can help each individual person going through the process. And then we automate away as much of the tedium, as much of the paperwork as is legal. And that's high level what we do.
Right, perfect. Yeah, that's one of the big things. You hear a lot of Medicare insurance agents and brokers out there, and for those kind of an agent, they're kind of used interchangeably, but kind of a captive agent kind of works for one company. So if you call that captive agent and say, hey, what plan should I choose? Well, they work for that one company. It's like the old Henry Ford. You can have any color of car you want as long as it's black. And there's other people's out there, brokers that say they look at all the plans, but there is some type of incentives that I think Medicare is trying to get rid of. They're not doing a very good job of it. But Chapter is the only one that we found that really looks at every single one. The advisors are 100% neutral. And I tell you what, Kobe, we've been working together for a couple of months, and I have nothing but perfect reviews. There's been probably the only hiccup is the kind of the capacity because there are just, I mean, and that's countrywide. There are so many changes to Medicare for next year. Nobody was able to keep up this time, but y'all did a phenomenal job helping people out. Everybody that was able to talk to you, 100% perfect reviews. All your advisors did a really, really good job. Compassionate, went through all the details, explained everything, and everybody's been very, very happy. So thank you, thank you, thank you for so much for all that.
Thank you. It's an honor to support everyone.
Yeah. All right, let's get into some questions. We'll jump around with some regular Social Security questions and future questions and Medicare questions and all the rest of it. So, Kobe said he was going to stick around here for the duration and see what he can come in there and answer for us. All right, here's the future of Social Security. Do you think the cuts will be for people already getting benefits, or will it be the future beneficiaries? We don't know because the cuts have never happened since 1935, so this is completely uncharted territory. Nobody knows, but usually politicians, when this happens back in the 1980s, the same thing. They always do it. Well, we're not going to do anything to your current benefits, but your kids, that's a whole different thing. We'll raise the age for them for 80 years old or whatever the case may be. But we shall see. Unfortunately, everything's on the table unless we decide to reach out there to our politicians and say, "Hey, here's the solutions we want." Um, let's see. Got a notification in the mail that my Social Security is only going up by $34 a month. That's too low for this economy. Yeah, that the 2.5% COLA increase wasn't very much, and then we got a Part B increase about $10. So that unfortunately, a lot of people out there. Make sure you watch the video. I did a video about a week or so ago on living on Social Security alone, and I talked about 50 different programs that might help you out. Medicare Savings Program, the Medicare Advantage dual eligible plans, and for those people with Medicare and Medicaid. So a lot of people don't realize that a lot of people are losing benefits. They don't realize they can get disability and survivor benefits, disability and spouse benefits, SSI and SSDI and Medicare and Medicaid. So particularly those people with Medicare and Medicaid, if you have the higher levels of Medicaid, then you're possibly, depends on your state, you're probably eligible for what's called a Medicare Advantage dual eligible plan, dual eligible. And those are the ones you see unfortunately advertised not great. Because there's cards out there. People always ask me about these cards all the time, the grocery cards, the over-the-counter cards, and they do exist. They do exist, but the way they're kind of advertised out there is You got someone that puts an ad on Facebook that says, "Hey, I've got this $4,000 grocery card, and you can get free ice cream and unicorns forever. It's so awesome. Call." And it turns out it's only available in one zip code in West Virginia. I don't know about the unicorns and ice cream for life, but that really high card is only available in one area of the country, but they advertise it to the entire country, which they're not really supposed to do. And then you call them up and they give you the hard sell, and says, "Hey, well, yeah, it's not available because you live in anywhere else in the country." And yeah, so avoid kind of the hard sell. If people cold call you, then that's yeah, it's always it's a scary thing. Chapter one of the things on Chapter is people email me all the time and say, "Hey, could you have someone from Chapter give me a call?" And I'm saying, "Well, actually, I can't. You have to call them first." So because yeah, we try to avoid all that as much as possible. In any the Medicaid, do you see anything happen with Medicaid dual eligible plans for next year, Kobe?
Yeah, there are a few changes happening to the dual eligible plans. One is the government is changing the special enrollment period or the enrollment periods for different types of dual eligible plans. So for one type, what are called coordinated or integrated plans, they will have a different enrollment period than non-coordinated dual eligible plans. So it's really important if you are on one of those to make sure that you understand the updated enrollment periods, because it used to be a quarterly enrollment period for all dual eligibles, and that is no longer the case going forward as of January.
Okay. What about the low income subsidy, the extra help with prescription drugs? Any changes on the enrollment period on those?
No changes on the enrollment periods for extra help or low income subsidy. There is a new prescription drug payment plan that allows people to pay their expected prescription costs monthly. And so for some people, it's really helpful because it allows them to have a more predictable schedule of payments. But this is the first year it's being implemented, really the first time period it's being implemented. So we don't know exactly how it will shake out in terms of the user experience and how the government will handle the volume of it. But it is an interesting program for people to look into.
Yeah, so for those out there, this is this is a good opportunity to talk about those. So extra help with prescription drugs, also called the low income subsidy. You apply for that at the Social Security Administration. I've done hundreds of thousands of retirement claims, disability claims, survivor benefit claims, and some of them get a little tricky. But the extra help with prescription drug is probably one of the easiest applications for Social Security. Very, very easy. You can do it online, do it over the phone. And it's basically if you have difficulty paying for your prescription drugs, please, 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 you again, this is a community. We've got a great community here. People always say, "Hey, I'm helping my neighbor down the street. I'm helping my brother or cousin or whatever." So please, if you know anybody is having a difficulty paying for their prescription drugs, make sure they apply. It's called Another name is low income subsidy. So, kind of as the name implies, it's you have to have low income, but you go ahead and apply. Social Security will evaluate it, and if you're approved, it's really, really going to help you out with your prescription drugs. As of what last year, this year, Medicare estimated it saves about $5,700 a year on average throughout the country. Next year, probably different because the max you can pay out of pocket is $2,000. But as Kobe talks about, the some people get a really high prescription and they're like, "Wow, $2,000, that's awesome and great. The max out of pocket is 2,000, but I hit that in January because I've got a really expensive medication, so I really can't afford $2,000 in 1 month." And so what you do is you call up your Medicare Advantage or your Part D plan, and I guess what the terminology is, smooth me, right?
That's right.
Yeah, I think that's the best thing I could come up with because it's technically called smoothing, right?
Smoothing the payments. That's right.
Yeah. So instead
Yep.
of paying $2,000 for 1 month or 2 month, they just kind of set up in a payment plan. So I think that's pretty awesome. I'm interested in people that call up and get that done. We haven't got any reports of anybody getting that done and how difficult it is or anything. Have you seen anything yet on the difficulty or
It's fairly straightforward to set up. As I was mentioning, because it doesn't go into effect until January, no one's had to interact with it or engage with it beyond the sign up. So that's where it's still a little premature to know exactly how people's experience with it is.
Perfect, perfect, perfect. Okay. All right. Oh, and kind of to dovetail with saving people as much money as we can. So we talked about Medicaid, and let's finish that thread in terms of if you are able to get the Medicare Advantage dual eligible plan, those are the extra benefits. But before that, if you are eligible for Medicaid, depending on your state and what level you're at, they have what's called the Medicare Savings Program, which is pretty awesome. So if you are eligible, again, please, everybody out there, subscribe, like, share this video. Um, People out there that are having difficulty paying the Part B premium. Next year, the Part B premium is going to be $185 a month. And if you or you know somebody that has a difficulty paying that, tell them to reach out to Department of Social Services, Department of Welfare, Medicaid. Before I worked at Social Security Administration, I used to do Medicaid at the Department of Social Services in my state, and they'll take an application, and if you're approved, they'll pay for your Part B premium, $185. So you'll get the extra help with prescription drugs. So your prescription drugs are pretty much no cost. You'll get your Part B premium paid. You'll be able to get a Medicare Advantage dual eligible plan, with depending on what's available in terms of extra grocery card or something like that. So there's so many people out there that just miss pieces of the puzzle. Social Security policy, just Social Security alone, is over 20,000 pages of policy, and unfortunately I've read it backwards and forwards a few times, and it's if you're it's all online. So if you suffer from insomnia, just type in SSA palms, and after about a page or two you'll be sleeping like a baby. So there's that. All right, let's see. Mary has a question. Urgent question. If I apply for a different Medigap plan and am denied because of a pre-existing condition, can I keep the plan I have, or am I just SOL? You wanna answer
Yeah.
that for me?
You can keep the plan you have as long as you haven't disenrolled from that prior plan already. Usually, I mean, it also depends if it's a Medicare Advantage plan or a Medicare Supplement plan that you're coming off of. If it's a Medicare Advantage plan, you will certainly be able to stay on the prior plan. We're still in the enrollment period as well, until it goes until midnight local time, wherever you are tonight. So if you want to confirm, feel free to call the number on the screen, and one of our Medicare advisors would be happy to walk you through it. But yes, you should be able to stay on the plan that you were planning to come off of, because you should not technically have come off of it yet.
Yeah, perfect. And this is the big one of the big things. One of the reasons I reached out to Chapter and tried to look for a place that's going to help out viewers, my community, is same thing that Kobe's parents had. When you're on a Medigap plan, a Medicare Supplement, a Plan F or G or N or whatever, um, particularly, I think this is going to be really bad next year. You also have to get a Part D plan, the prescription drug plan. The same time you sign up for Part B, as in boy, you also have to sign up for a drug plan, Part D. And what I see happening, as Kobe can attest, that the agent signed you up for a Medicare supplement plan, and they get their they get their commission. They're able to support their family. Fine, great. But they also need to go one step further and also enroll you in a Part D plan. If you're in a Medicare Advantage plan, most of those have Part D embedded within the Medicare Advantage. But I'm talking about a Medigap or Medicare Supplement plan. If you have one of those, you have to get a Part D plan. And what happens is people, they sign them up, and then, oh, I also need to get you a Part D plan. And the person, oh, no, I don't need a Part D. I don't take any medications. And then, because particularly next year, these agents aren't really getting commissions on the Part D, they're like, okay, all right, fine, bye. And guess what? You're going to get penalized 1% for every month you did not sign up for Part D when you were supposed to. For Part B, as in boy, you get 10% penalty for every 12 months you did not sign up for Part B when you were supposed to. So there's penalties for both of those. And unfortunately, I think because the way the industry, they're not giving commissions on Part D anymore, there's going to be a lot of people that reach out next year and say, "Hey, how come I'm getting penalized for the rest of my life, forever?" The Part B penalty is forever. The Part D penalty is forever. And these are different because people often confuse those with the extra premium for Part B based on IRMA, high income work earners. They only get that extra premium for 1 year based on their income for 2 years ago, and so you can see we're way down into the weeds there. But the whole thing is a nightmare. That's why it's always good to that's why I'm doing these videos about Social Security, and that's why Kobe and his team is helping everybody with all things Medicare. All right, Wanda, are you working on the petition I spoke on? Yes, Wanda, I've already pretty much written it up, and yes, Wanda had a good idea for a little petition to see if we can um, convince politicians to kind of do their job. Why we send them to Washington, I guess. Yeah. So anyway, um, yes, Wanda, that will be coming out very soon. Linda, I'm 81 years old, FEHBs, Federal Employment Health Benefits, retiree with a one-time opportunity to get into a Medicare Original with a Medigap Plan N without underwriting as a first-time Part B participant instead of the new. Um, so, what do y'all do when you federal employees want a Medicare
Yes.
Supplement or Part B?
Yes, it really depends on the specific person. In many cases, the federal retiree plan is as good or better than a Medicare supplement plan, and with lower cost. And so in that case, we would suggest the person stay on their federal health plan. But that's not always true. There are definitely cases when the federal health plan does not cover what the person needs or is more expensive. So in this case, I definitely recommend you call and talk to one of our advisors to discuss your specific situation. And as you point out, it is a one-time opportunity when you leave when you retire to not have to go through underwriting to sign up for a Medicare supplement plan. So it's important that you make the right decision. So it's a very important question.
Perfect. Yeah, that's one of the other reasons my son and I have really been convinced that we made the right choice in picking chapter. Uh, Y'all tell me every now and then, every week says, "Oh yeah, we've helped out this many people," but we've also helped pretty much just as many people confirm that they were in the right plan. So that's awesome. So it's like, "Oh yeah, we talked to your people and we switched 100%." It's like, "Oh, that would be a tad bit suspicious." But yeah, y'all are doing a great job in terms of, oh yeah, we checked out this person's plan. They checked out the doctors for next year. We checked out the prescriptions. We checked out what they need in terms of their dental and vision and all their needs and stuff like that. And we looked at their current plan. We didn't have to do anything. We talked to them for an hour or 2 hours and stuff, and they were good. So we appreciate that, Kobe. I really do appreciate that.
Likewise, it's a core component of what we do.
Yep. All right, let's see. Kala, I'm 57 on SSDI. My his is going to collect his Social Security at 67, and now he's 64 and a half. Am I eligible to apply for spousal on top of my SSDI? I am getting questions, so my income will increase. SSDI plus spouse. Yes, this is another one of those programs out there that people are missing a lot of money. Unfortunately for you, no, because you have to be 62 years old. But when you reach 62 years old, you can file for spouse benefits. You can file for current spouse benefits. You can file for divorce spouse benefits, what's called independently entitled divorce spouse benefits, surviving spouse benefits. A lot of people think when they're on SSDI that they can't get any other benefits because if they do, that's going to replace their disability. And people say, well, I don't care that I'll get more money. But their issue is they think it's also going to stop their Medicare. And that is incorrect. You can have disability, SSDI, and have spouse benefits, surviving spouse, divorce spouse benefits, and it's just added to your disability. The benefits or surviving spouse benefits or whatever the case may be has to be more than your benefit. So if you're getting, let's say, $1,000 right now and you're entitled to 1,500 from a spouse, you'll continue to get your $1,000 from disability. and then you'll get an extra $500 from that person. So your disability is still in effect, and because your disability is still in effect, you're still able to get Medicare. Your Medicare will continue. And the great thing about being on SSDI is once you hit your full retirement age, whatever it is, 66 and 8 months or 67, then guess what? You're no longer technically on Social Security disability. You're switched automatically from disability to regular retirement benefits. So when that happens, you no longer have continuing disability reviews. You no longer have work limitations. You're on regular retirement benefits. And so you can do whatever you want. So people out there that are on disability, here's the times in your life that you really need to check. If you're on Social Security disability insurance at 60, you need to see if you're entitled to any survivor benefits. When you're 62, you need to see if you're entitled to any spouse benefits, divorce spouse benefits. When you're 65, you need to recheck to see if a Medicare supplement was right for you. Because in most states, um, people under 65 cannot get a Medicare supplement plan, a Plan N or a Plan G. They just don't offer them in most states. Some states they do, most states they don't. And even if they offer them, usually it's 2 or 3 times what everybody else is paying for that same plan. So a lot of people, the only thing they can get is a Medicare Advantage, even if they wanted a Medicare supplement. But when you turn 65, guess what? You're in a golden opportunity, that golden window to where you can get any Medicare supplement plan you want, and usually N and G, and no health underwriting, no questions. You just contact chapter there, and they'll switch you from whatever Medicare Advantage plan you have to a Medicare supplement. Go through all the options, check to see which one is best for you, an N or a G, and of course, don't forget about the Part D prescription drug plan. And so 65 is a crucial year for those people on disability. And then 67 years old, or your full retirement age, you're no longer on disability, you're on regular retirement benefits. So places like New York and some other states are kind of exceptions to that rule, right, Kobe, about not being able to sign up for Medicare supplements under the age of 65?
Um, there are special rules for different states with different underwriting requirements. In Connecticut, New Jersey, New York, or sorry, not New Jersey, Connecticut, New York, and a couple other states, California, there are different rules for that allow you to switch outside of your initial enrollment period without underwriting. And in other states, in most other states, you do have to undergo underwriting when you do want to enroll into a Medicare supplement plan or switch Medicare supplement plans after your initial enrollment period. That's right.
How long? What's the whole underwriting process usually? People think they have to go to the doctor and get a physical and
Yeah,
cough and
it's
all
very
that kind of
different.
stuff.
It's very different than life insurance. It's much more simple. It's just a set of questions that you have to answer. And so each insurance carrier for each plan will have a list of questions that they will make you answer. It's things like, have you had a cancer diagnosis in the past? Have you, in the past 3 years or 7 years, have you had have you had to take certain prescriptions in the past 3 to 7 years? It's questions like that. So it's really it's not intrusive, and it doesn't take a lot of time to go through the process. But if you have to say yes to those questions because you've had those medical issues, then you can be denied coverage. One interesting thing is that different insurance carriers ask different questions for underwriting. And so there are times when you'll be approved for one plan, but not for another plan. And so because we look at every option, we can also guide people to understand which plans are more likely to accept them than others based on those underwriting questions, which we have all the data for.
Good. Yeah, that's right. You're data guys, right?
We are.
All right. All right. Megan says, "Hi, Kobe. Thank you for your help," and a little heart there. So awesome, awesome.
My
Let's
pleasure. Thanks,
see.
Megan.
Uh, I think Megan's a regular. Do I have to report pension payments received if I'm also receiving SSDI? Normally, no. The only exception is if you're one of the people that paid into a non-covered pension. So if you work for a state or local government agency that did not participate, did not join the Social Security program, that's the only time. But it sounds like in your particular case, no, it's not relevant. SSDI is not an income or means tested system. SSI, Supplemental Security Income, is a welfare-based program that Social Security took over in the early 1970s, actually celebrating the 50th year of SSI, Supplemental Security Income. If that's the case, yeah, because it's a means-tested, income-tested program, any other money coming into the house, yes, will affect those benefits. But SSDI, no, pensions don't affect it. Dr. Ed, is there a burial benefit of 2,900 for seniors? No. In terms of Social Security, there is the lump sum death benefit, which is the whole $255. I've given out hundreds of thousands of those checks, and nobody has ever been excited about $255. It's been the same for decades and decades and decades. But there is a bill in Congress that they're trying to raise that finally to $2,900 to help out seniors for burial. But yeah, I don't think we shall see. Thank you both for your service to our country. Thank you. You're welcome. Another one. Thanks, Kobe, for your help. All right. I'm a state employee, and when I retire, I will have to sign up for Medicare Part A and B. Then the state insurance is my advantage, including drugs and dental. Is this all someone needs in general? What you say that, Kobe?
Um, it depends on your situation, both on what you need in terms of your prescriptions and whether those are covered under the state plan, and it depends on what the state plan covers. So I would certainly recommend you talk to one of our advisors to make sure that it covers. In many cases, that is all you need, but it really depends on your specifics.
Yeah, that's what I found. Most of the times, it's more than enough, but every now and then depends on, I guess, how the city finances are doing, the state finances in that particular, yeah, that particular neck of the woods. Sometimes they're pretty cheap out there. Same type of thing in companies. I get that question quite often. That I guess a lot of companies are also moving to Medicare Advantage. In the old days, you worked for a company for 40, 50 years, you got your gold watch and you got your pension, and they said, hey, we'll take care of your health care for the rest of your life. Um, but I see a lot of companies moving that healthcare to Medicare Advantage. And sometimes those plans are really, really good, better than what's out on the open market in that particular area, but sometimes not so much, right?
That's right. What we see a lot of is uh, either a company, especially a large company, will negotiate specific benefits with a large insurance carrier like Aetna or United, and they'll heavily subsidize it. So instead of having to pay a premium or instead of having to pay high copays, the employer will effectively subsidize or negotiate for those costs to be lower. And so that's wonderful when that happens. In many cases, though, if the employer isn't as large or doesn't, for whatever reason, doesn't have the negotiating leverage, the plan won't actually be all that good. Or it might not be great for your needs. Maybe it has a formulary that your specific three expensive drugs are not. And so we do recommend that people really look at the plan details that are given with that employer coverage and compare it to what's available on the open market, because it shouldn't be, it's not a given that the employer plan will be better. And we see that a lot, that people assume that, oh, my employer negotiated this plan for me, it's special for me. That means it must be the right one for me. And unfortunately, that's just not how it works.
Right. Yep. Um, yeah, so this is the end of the annual enrollment period, but what do they say? The Bureau of Census says what 11,000 people are turning 65 every single day. It's what the silver tsunami. So I guess y'all's work ain't done yet, right?
Doesn't end. And two things I'll note. One is that certainly if you are signing up for Medicare for the first time, either because you're turning 65 or you're leaving your employer, you're retiring, you can sign up based on that date, your birthday, or that retirement date. It's not based on the enrollment period. So certainly make sure that you're signing up within the period that's appropriate for you. And you can always call us with any questions. The second thing is in January to March, January 1st to the end of March, there's another enrollment period called the general enrollment period or the open enrollment period, which allows people who are already on a Medicare Advantage plan to switch to a different Medicare Advantage plan if they're unhappy with the plan that they switched to. But you cannot switch to a Medicare Advantage plan from a Medicare Supplement plan. Not that we generally recommend doing that, but that's not allowed. It's only for people who are already on one Medicare Advantage plan who want to switch to a different Medicare Advantage plan. So that's also possible in Q1, in January to March.
Okay, perfect. Yeah, a lot of people that reached out and they said, "Yeah, I just had something come up, and I don't look like I'm going to make it to December 7th." And so there is that other opportunity. So between today and December 31st, really can't do anything, right? Have
That's
to
right.
wait until January 1st. So call January 1st, or can they call like 20 the
They can call
26th?
they can call over the next 2 weeks. We have all the plan information, so there won't be any new information. We won't be able to actually sign the documents to switch the plans until January 1st, but we can get everything prepared now, send you an automated email or text, and can make it quite quick to finish the enrollment process if you want to complete 90% of it in the next 2 weeks before January 1st.
Okay. So for those people that maybe want a second opinion, someone else enrolled them or they did it themselves, and because y'all, how much do y'all charge for this?
It's free. We don't charge anything.
All right. Yes. And if anybody ever charges you, any Medicare insurance agent tries to charge you money for enrolling and stuff, then yeah, that's a big red flag. But yeah, so if you want to double check to make sure you actually enrolled in the best plan for you, reach out to a chapter there. I would probably not tomorrow. I think all of your advisors are going to be sleeping for about 24 hours, but the day after possibly.
We are taking tomorrow Sunday off because it's been a very long 2 months or so. But we're back to normal hours Monday.
Okay, perfect. Yeah, this has been the most tumultuous Medicare enrollment period I think in decades because of all the changes for next year. So yeah, if you're looking for a second opinion, you weren't sure you signed up for whatever that person that called you up from that Facebook ad sounds kind of sketchy. Yeah, reach out to a chapter in a couple of days, and so they can go through all the plans for 2025, ask you about your doctors, your prescriptions, dental or anything like that. They can't do any. They can't. I guess you can't push the button until January 1st. And if that happens, when will their new policy take effect?
January 1st. Oh,
January
if
1st.
they sign up, sorry, if they sign up for if they want to switch their plan on January 1st for a new plan, it can become effective as early as the first of the following month. So February 1st in this
Okay,
case.
February 1st. Okay, so if you do it in January, February 1st. If you do it in February, it'll start March 1st, and March starts in April, right?
Exactly.
Perfect. Perfect. Good evening. Can you please explain the new Medicare drug payments in 2025? I just learned about this today. I am concerned and confused. You want to? I think that's the smoothing we were just talking about, right?
I believe so. I'm not sure if there's a more specific question there. There have been a few things that have changed about the Medicare prescription components this year. One is, as you alluded to earlier, because of the way that insurance carriers are trying to limit the number of people who enroll in different Medicare Part D plans. Many Medicare advisors, Medicare agents are not supporting their clients with it, and so many people are getting confused about what's covered and what's not. So that's one element. The second is this new smoothing program that allows you to pay a fixed monthly amount instead of paying ad hoc amounts that change every month. So it allows for predictability and budgeting, which is nice as part of the program. So those are the two broad changes. I'm not sure if there is a very specific question. Feel free to call one of our advisors, and they'll be happy to walk through your specific question.
Yeah. Yeah, that's I'm all for, the individual Medicare insurance broker that, you went to high school with, cousin, nephew, you gotta support them, obviously if you need help, that's your first choice. It has to be your first choice or, you're going to have a very terrible Thanksgiving. Um, but one of the problems I see with individual insurance brokers out there is, they can enroll you and stuff, but it's kind of that after sale service that they're often wanting. You call them up and they say, "Hey, I'm having a problem with this. I'm having a problem with that, and what can you do?" And they're good at enrolling people, but they don't really know that. And that's another reason I chose Chapter because y'all have your member success team. And what type of things can they help out with?
Yeah, we have a full-time dedicated member success team that's here throughout the year to help you with really anything you need that has anything to do with your Medicare. So we frequently help people find new doctors who are in network with their plan, find ways to, if they're cheaper ways to get the prescriptions they need, whether it's through a prescription drug discount program, or making sure that they're going to pharmacy that's in network with their formulary and with their plan. We help people if they have questions on their bills or their claims. If you have questions, if your insurance carrier is denying you authorization to get a service or surgery done, we'll certainly help you navigate that. Really, anything that you're having an issue with or having trouble with when it comes to your insurance carrier, we're happy to help you navigate and walk through that. And that
Yep, and
again is free of charge. It's just part of what
that
we do.
is that is very, very, very unique. Not many a lot of people say they do that, but, yeah, it's to have that full-time staff that are specifically dedicated to that, and we had your supervisor, the person that's in charge of that section, be one of the guests on our show and, answered a bunch of question, and from I think something in the news, prior authorizations are kind of a big issue right now, right? So,
They are.
a lot of
Yeah.
a lot of so with if you're denied, the doctors help out, but sometimes the doctor's offices, they're kind of inundated themselves. And if you have chapters, the people that helped you enrolled, reach out to them, and they can, usually it's a billing code issue if you get charged incorrectly, or they can help you without any prior authorizations or anything. So that's a great, great service. Let's see, Nancy, both my spouse and I can't afford to buy a supplement plans because of his health. His is expensive. I took an Advantage plan my first year on Medicare. Yeah, that's I think pretty much everybody would want a Medicare supplement plan, a plan N or a G, Medigap, same thing. But it's, because there's no prior authorizations, there's no networks. I always say if you have a Medicare supplement plan, your network is America. Any doctor that takes Medicare, any hospital that takes Medicare, accepts your plan. Doesn't matter which one it is. But it's the deciding factor is always the prices. Those Medicare Advantage plans have the zero premiums, a lot of them, and but it's kind of a pay-as-you-go system. Do we see anything happening along those lines? Prices for Medicare supplements, they seem to be going up or down. Any changes you've seen for next year?
In most cases, Medicare supplement prices have been going up, but not disproportionately to in the past. It's pretty common for premiums to go up. I will say that, of course, not everyone's in this situation, and it depends on your personal finances. But many times, Medicare Advantage plans have pretty high maximum out-of-pocket costs, up to close to $9,000, $8,000 to $9,000 often. Not always; it can range. But if you are sick or your partner is sick and they are going to be using their healthcare a lot, and there are a lot of copays and a lot of ad hoc payments you're going to make, and especially if you're going to spend time in the hospital, that's where costs can really go up. That can be a lot more expensive than 150 or $200 a month Medicare supplement plan. That once you do pay that, you're probably not paying for much else. And so again, it depends on your personal situation, but if I wouldn't assume that a Medicare Advantage plan is cheaper on an annual basis than a Medicare supplement plan, depending on your specific situation.
Perfect. I'd love to hear that. Yes, if people that watch my channel know, I always recommend, if you're new to Part B, if you're looking to sign up for, to cover all the gaps of original Medicare, always start with Medicare supplement plans. I recommend Plan N because I'm cheap like that. And then, go to a Plan G, compare the two. I kind of prefer N, but either one of those is perfect depending on your particular situation. And nobody can tell you. And never, never, never go with, oh, my next door neighbor has this plan or my cousin has this plan. It's all specific to your specific needs, your financial, your medical, your doctors, your prescriptions, and all the rest of it. So start with a Plan N, Plan G, look at those first. But if for some reason you're just not able to do it, but yes, take into consideration what Kobe was talking about. The zero premiums are enticing, the extra bells and whistles, the dental and the gym membership. Yes, that's all great and awesome. But, this is health insurance and it should primarily cover your health. And the issue is when you're young, 65 years old, I never thought I would say 65 is young, but it is. 65 is the new 30. Um, and you're healthy, you're like, why should I pay all this money for a Medicare supplement plan? I'll just go ahead and get the zero one because I'm healthy. I don't need it. I'll be wasting money and I'll just switch to a Medicare supplement later. And then you go on with your life in 4 or 5, 6 years and you start getting sick. And then, you try to switch to a Medicare supplement plan and then you have to go through all the health underwriting, what Kobe talked about. So if you fall or, get sick or something like that, then unfortunately that particular door is kind of closed to you. So please, kind of do the right thing and look at the long term. So it's great to hear Kobe and I are all 100% on the same page there. How much money can you make while on Social Security? Wow, big. If you're on just regular Social Security retirement benefits for next year, it's $23,400. So anything over that, Social Security holds back $1 for every $2 you go over. If you're just signing up for Social Security, then the first year they can switch to a monthly. So next year it's 1950. So the first month you go under $1,950 and stay under that for the rest of the year, then you can get your Social Security benefits. And it doesn't matter what you made before then. You can make $1 billion from January until April, but if you stay under 1950 starting in May, then you can start your benefits. It doesn't matter how much you earned before you start your benefits. That's only for the first year. Chapter was very helpful to my disabled brother in choosing the best plan. Tons of hearts there. Ah, awesome. Y'all are knocking out of the park. Appreciate it. Uh, let's see. Just signed up for Social Security and Medicare. Got A and B. Didn't know about drug D. So this past week, hubby and I got Advantage Plan Silver. Got letter today, and it said I have two use PPO doctor. Yeah, so there is. It depends. So Medicare Advantage, they have a PPO or an HMO. People are often confused about those. Medicare supplements, again, your network is the entire country. What's difference between HMOs and PPOs, Kobe?
HMOs have more narrow networks. PPOs have broader networks and still have coverage for out-of-network doctors. You have to pay a little bit more, but they are covered, whereas HMOs typically don't cover out-of-network doctors. And there are other differences, but that's really the primary difference that people see.
Yeah, if you're in the big cities, rather, large metropolitan area, usually the HMOs, they've got a lot more benefits to them. But if you're out in the country and there's not many doctors out there, you probably, again, depending on your particular area, you might want to lead to a PPO. That way you've got more availability. But HMOs in the bigger cities usually have tons of doctors to choose from. Again, it really depends on the particular area. So. Currently on a Medicare Advantage, getting off because I am going back to work using employer medical. When I stop working again and restart Part B, will I be eligible for a supplement without underwriting? You want to take that one, Kobe?
That is a great question. I am 98% certain that the answer is yes. You will be eligible. You'll have a new special enrollment period when you leave your employer coverage, which will give you a new period when you can sign up for a Medicare supplement plan without having to go through underwriting. I'm 98% certain. I would want to double check my notes because that is a bit of an edge case, but I'm pretty confident that the answer is yes. But
Okay, perfect.
when you get there, definitely give us a call and we can walk you through it.
Perfect, perfect. Yeah, the states, people always wonder about that. And says, how come, the Medicare supplements and whether they can give you one is, state specific, but this is a federal program, and the whole thing is just way, way too confusing. Some states, I guess the health insurance companies have gone into the states and convinced the state politicians to please don't make us offer, these plans to anybody under 65. And so I guess it really depends on the state legislatures of, because all insurance is state regulated. So I guess it's kind of that federalism thing, and that kind of the tug of war between the states and the federal government, right?
That's right. Well, actually, one interesting thing to note here is that Medicare Advantage is regulated at the federal level, Medicare Advantage in Part D by CMS. Um, Medicare Supplement is regulated at the state level. And so there are departments of insurance at every state that also regulate other components of the insurance landscape. But it is interesting that CMS and the federal government have basically no regulatory oversight over Medicare Supplement. So it's an entirely different regulatory regime, which also
Yeah.
adds to some of the complexity.
Yes, yes, some of the fun. Let's see. If my SSDI is affected by the cuts, would the limit of how much I can earn at the part-time job, I don't go over 1150, so I'm not put into the ticket to work. Um, yeah, we don't know what's going to happen. Anything politically right now, the new administration is talking about things. They're talking about different things being on the table. But I've been around this rodeo for many, many decades and seen many presidents come in and many go out, and commissioners coming in and coming out, and they always have these grand ideas. Sometimes they come to fruition, sometimes not. But make sure you subscribe. I'm going to keep you all up to date, and anything I see or hear, I'm going to make a video of it so y'all have a heads up on what you need to do. So I just got a text message saying there is a message from Social Security. How do I know if it's a real or a scam? Yeah, Social Security Administration. Kobe should have helped them out decades ago, but I don't know if you can. Are you proficient in COBOL and Fortran, Kobe?
It's a great question. I actually did personally deal with migrating DHS's COBOL system, green screen mainframe, into a modern platform. So I am more familiar than I'd like to be.
Wow. I was asking that as a joke. I didn't know you
I
actually
know you
were.
were.
Holy
I know you were.
Wow. Yeah, because the Social Security Administration, the system is called MISIX, MCS, modernized, yeah, a modernized claim system, but it's based on the base is COBOL and Fortran. And so in a lot of respects, I guess Social Security are a bunch of Luddites. But they have finally come around, and the online my social security, which I recommend everybody, please go on to ssa.gov, set up a my social security account, because when you set one up, it makes it so much harder for someone else in the country or someone else in the world to go in there and set it up and pretend to be you, and change your direct deposit or cause you any type of trouble. So they have updated that. They have stopped to save money, which is a great thing. I used to process the mail in my office, and we used to spend a lot of money on postage in my office. And they are trying to get rid of that, which is a beautiful thing. And so they're going to, rather than mailing you these letters, they are notifying you one way or the other through email or text or however you set up in My Social Security. And they notify you that, hey, there's a message in your My Social Security. So if you get an email or message like that, just use it as an indication. I probably wouldn't click any button, because there's going to be scammers out there that use us as an opportunity to scam. I would just say, "Oh, looks like I've got a contact from Social Security. Okay, I'll delete that, and I'll go to my Social Security account, and I'll see if it's actually a message." So it's probably a notification from Social Security, but I wouldn't trust it. I would go right to socialsecurity.gov, SSA.gov, and see what it is in there. So I think that's a great thing. Social Security is going to save a lot of money. And one of the things that, people were entitled to more benefits if they were receiving, widow's benefits, surviving spouse benefits, and they turned 70 years old, and now their benefits on their own record is more. We used to send letters. Every office in the country sent you a letter that says, hey, you can get more money if you switch to your own record now. But people, they move and they don't get the letter. So there's a lot of people out there that are missing money because they didn't switch to retirement benefits on their own, and, snail mail. But now they've got this electronic notification. I think hopefully a lot of more people are going to get that money. And because y'all are going to subscribe and share and like and all that kind of good stuff, and share this information and make sure y'all's friends and family get those benefits. All right. Another question. If my deceased ex-spouse had a bigger Social Security check, do I get 100% if we were divorced and married 10 years? I never remarried. So your deceased ex-spouse, you could get up to 100%. You were married 10 years. So you fulfill that requirement. Your benefit will be 100% if you wait until your full retirement age. Anytime you take benefits from Social Security early, in most cases, it's reduced. But in your particular case, I would reach out to Social Security. call the 800 number and say, hey, I want to file for a surviving spouse claim. And if you don't know the social security number, no problem. Just tell them the person's name, their date of birth, where they are born, as well as you know that. They'll be able to find the social security number, and they'll look to see if there's any extra benefits on that person's record. And if there is, they'll schedule an appointment. But what I would do is when you had that appointment, I would ask two questions. How much would my surviving spouse benefits be if I started right now? And how much would it be if I waited a year? And that way you can make a better estimate of when you should start those benefits. All right, let's do one more question. Let's see. Can the Advantage plan I picked out for 2025 be changed? Let's leave it at that. That'll be the last question.
Yes, it can. If you chose an Advantage plan over the past few weeks, you can change it starting on January 1st. And that change, let's say you change it in January, it can go effect starting February 1st, the change. So you can change to a different Medicare Advantage plan between January 1st and March 31st.
Perfect, perfect. All right, and we'll leave it at that. And Kobe, I really do appreciate you helping out, or help. I really appreciate your team helping out, the member success team, the advisors. It's been an interesting Medicare season. So wish everybody a 24 hours of sleep. And if they have a difficulty falling asleep, make sure they read the Social Security policy for a couple of minutes, and that'll put them right to sleep.
Thank you so much for having me, Dr. Ed, and thanks for everyone. Excited to continue to support everyone.
All right, you take care of yourself. Have a great one.
Thanks.